Hello, everybody. Happy Wednesday. I do know what day it is. It's Webinar Wednesday with Dr. Scott Munsterman, and we are here to tell you all about chiropractic and telehealth. I know y'all are so excited. He is the man. He really is. Y'all have no idea how many hours he has spent researching, double, triple checking everything during this COVID-19 crisis. And I can't thank him enough. Not to mention, he has dedicated an hour a week to me from now until who knows when. And
What?
so, yes, I done cleared it on your schedule.
Okay.
I know people.
Yeah. Okay.
So, without further ado, Dr. Munsterman, let's do this.
Hmm. Hi, this is Dr. Scott Munsterman. Welcome to Telehealth 201, making it work in chiropractic practice. And we have a special thanks to Best Practices Academy, ChiroArmor, eChiro EHR, and ChiroHealthUSA for bringing this module to you. And of course, our disclaimer is that we know what we know at this particular point in time. We've done research on the coding side of it. And looking at what Medicare has to say, and the CDC and HIPAA and many various state and federal agencies. And our advice to you is to get as knowledgeable about telehealth as you possibly can. And we're going to talk about how to get that accomplished today, and how to actually hit the ground running and practice with it as well. And just keep in mind, though, that this is not legal advice, but again, we encourage you to ask questions to your healthcare attorney, malpractice carrier, national, state, local government authorities as well. And so where do you begin? Well, this is Telehealth 201, so that means that there is Telehealth 101 somewhere. Well, you can just follow this link. It'll bring you right to the very first module that we put together on telehealth. And that module was all about understanding what state law requirements are and how important it is to cover your bases when it comes to understanding the rules and the regulations regarding telehealth. And of course, these two links here, and we're going to go ahead and click on them both here. This very first one, they both provide you very good information about your state. And so this is in regards to a 50-state survey. This group, Foley and Lardner law firm, they actually do this, I guess, on an annual basis. But it has some very good information about state. Where do you stand on different aspects of the telehealth law? Does it have a statute? Is there a coverage provision? Is there a reimbursement provision? So on and so forth. And then the other one that we also recommend that you review as well is this one from the Center for Connected Health Policy. And you can find your state on the list. You can go ahead and pick what category you want, if it's Medicaid or private payer, and then you can pick even topics. And so, for instance, on this particular one, it references the consent and a number of other topics as well. And so, again, very good links. And it's important to get your research done and for you to be knowledgeable on state law and what are the provisions that your state may or may not have or have addressed through the law. Now, this was great. I love this. Dr. Spillman, he graciously gave us his permission to show this and just talk about it. What he did, he sits on the board for the Unified Virginia Chiropractic Association, and he put together this matrix on the procedure codes that are coverable, and then of course the health plans and whether they cover them or not. He built out what are the modifiers that they're saying that they need to use, all of that. And so this is great. This is what each state needs to do, frankly, whether it's your state association that is tasked to doing it. But this information is so important to guide you as to what your commercial payers are up to in your state, and to make sure that they're following the state law. That's the other thing that we're going to find as we get into this area of telehealth. It's a new territory for a lot of providers, well, especially for chiropractic clinicians. There will probably be some pushback from insurance companies, as you can imagine. And so it's understanding, number one, what is your state law, and then number two, understand what those commercial payers have within their benefit plan, and then make sure that of course that state law is of top concern or top priority. And so the key here through this whole thing is developing your telehealth services within coding requirements. And so it's all about understanding the coding requirements that will give you insight as to how that service is provided. All right. And so as we did the analysis on this, we've boiled it down to two nuggets. Okay. Number one, first and foremost, telehealth in general and traditionally has been provided to established patients and for established patients. Now, until recently with the COVID-19 crisis, we've seen some lessening of that with some commercial payers and Medicare in regards to seeing new patients. But for all practical purposes and from the standpoint of how we may deliver maybe neuromusculoskeletal care, looking at it from an established patient's perspective is probably a great place to start as we get into telehealth. And so there's two key nuggets here we want you to focus on and think about. And so I'd like you to clear your heads as we think about this. The number one is new concern, a patient that has a new concern. They're calling into your office. They're saying, Sally's calling in and saying, I've got some problems with my low back. So then what are you going to do with that? Well, there's a couple of things that we're going to go down the road of in terms of options. And then we have the patient that is under current active treatment. They have a treatment plan. They're currently being seen maybe a weekly, biweekly, whatever basis. And so they're within a current treatment plan. And so envision those two scenarios in your mind. That patient calling in with a new concern, okay, or as you'll hear in just a minute, maybe coming in through your portal, okay, or other means, texting you, contacting you with a new concern, whatever that means, whatever method of communication they use, contacting you with a new concern. And the other scenario will be that patient under active treatment. So let's talk about that. We're going to talk about the patient, first of all, that connects with you because they have a new concern. And so the key question then to ask, does the patient have a concern that requires clinical follow-up? And so if they do, if it's something that needs clinical follow-up, of course, the first option is an option that we do many times, and that's just get the patient scheduled for an in-office visit. And that's always an option. The second option is, what if that patient connects with you through the patient portal? If your EHR has a patient portal and that patient is communicating with you through that patient portal, then your back and forth interaction with that patient is telehealth, and that's called an e-visit. We're going to talk about that in just a minute. Our third option is that patient, Sally, says, you know what, I've got some problems with my back. I need to talk to Dr. Chad about it. Can you have him call me back? And so when Dr. Chad connects with that patient, then that is what's called a virtual check-in. That callback by the clinician, or that response, the patient initiates the response to the clinician or to the office. The clinician returns that response in that callback. That is called a virtual check-in. So let's look at each one of those options. And again, keep in mind, this is an established patient who has a new concern. They could be calling on the phone. They could be using the portal. They could be texting. They could be emailing. All right. And so these are things that they could be doing. Now, keep in mind, there are secure ways of doing things and there are unsecure ways of doing things. And many times patients will do things, text, and they won't realize that that is not a secure method of communication. And so making sure you educate your patient on these forms of communication are very important from a secure perspective. So let's just set aside that conversation for now and talk about the communication. And so this is a patient, established patient, with a new concern. And of course, as we mentioned, option A would be to go ahead and schedule Sally for an in-office visit with Dr. Chad, right? And so that's just the usual process that we can go through with patients. Secondly, as we look at The other form of communication, that has to do with Sally, the patient, communicating through the patient portal and comes in through the EHR system. And that is known as an online digital evaluation management service, or an e-visit. Now, what's important, and you're gonna hear me say this time and time again, so it's going to be a broken record here. We need to obtain informed consent before we proceed with any telehealth. And so there's a couple of reasons why that is, and as we get to the informed consent later in the module, we're going to discuss that. But it's very important that that patient understands that this is a billable service. That's one of the big reasons for the consent, is so that they know that they have some cost sharing that's going to come into this from their perspective. And so patient portal is seen as a telehealth visit, back and forth. The patient says, has a question for Dr. Chad. Dr. Chad sees it in the portal. He turns around and responds back to Sally. Sally responds again. They may go back and forth 2-3 times. Well, it's the cumulative time that we need to keep track of during that 7 days, that we are billing for. Okay, and we'll talk about that. But the other option is that not only can the clinician respond to the patient back and forth, and then it would be billable, but also what's called a qualified non-clinician. Now you go, Scott, what is a qualified non-clinician? The best advice I can give you in that regards, again, revert to your state law, talk to your board of examiners, talk to the health or commercial payers as to what their definitions are for qualified non-clinicians. And so if you have a professional within your practice that may be certified by your board of examiners or licensed within the state, those are potential qualified non-clinicians. But again, make sure that you do your homework on your state law. Talk to your board of examiners, talk to the commercial payers, so you have clear definition of what a qualified non-clinician is. All right, and so the patient, Sally, is communicating back and forth through the portal, right? And so Dr. Chad goes back and forth, and within that 7-day time period, by the time they're done going back and forth, Dr. Chad thinks, okay, I spent 12 minutes going back and forth with Sally, 5 times. Each time probably took 2 or 3 minutes for me to do that. The thought process and getting things back to Sally, so on and so forth. And so that would be a 99422 because it fell within the range of 11 to 20 minutes. And of course, this is a non-visit chart entry, and you would have the history of the patient portal communication back and forth. If you do have a qualified non-clinician, then those codes are reported differently, and those are 9-8 codes. And again, we talked about qualified non-clinicians. Make sure again that you check state law, payers, and your board of examiners to make sure that you have that defined with much clarity. So that's the patient portal. So we talked about 2 options so far. The patient with the new concern, right? Let's just say they're calling in. Sally's calling in. Well, Sally's either going to get scheduled in-office visit, or maybe Sally isn't calling in and she's going through the patient portal and connecting with Dr. Chad that way. But then we have a third option here that is called the virtual check-in. And of course, this is when that provider may respond back to a patient's concern, either telephone or maybe they go on audio video, and we're going to have an example of that here in just a bit. It could be secure text messaging, emailing, or use of the patient portal, but it's discussing a concern with an established patient, and the time spent is 5 to 10 minutes. Now, it's only a provider who can bill or report evaluation and management services, and so that narrows it down considerably as to who does the virtual check-in. So let's look at a virtual check-in scenario, okay? Sally calls the office, and she's away. She's got Joey at a soccer game 60 miles away, okay? And Joey's an established patient. He's playing soccer, and he just turned his ankle. So Sally wants to speak with Dr. Chad to see what he thinks she should do. And, of course, the staff person informs Sally that Dr. Chad will be able to return a call within the next hour, but the staff person also requests verbal consent from Sally that she understands that this is a billable service. And, of course, Sally consents. Again, got to have consent. So then Dr. Chad returns Sally's call timely and discusses Joey's ankle on the phone. And of course, in the course of the conversation, Dr. Chad asks Sally to send him a picture of Joey's ankle. And after informing Sally that sending via text is unsecure, Sally acknowledges that and sends Dr. Chad a picture of Joey's ankle. So then Dr. Chad reviews the picture and makes a recommendation of self-care management. How many times has that happened to you? It's happened to Dr. Chad a lot. And so as we think about the virtual check-in scenario, there's a couple of potential results from that interaction, okay? And it all hinges on, does Dr. Chad think that he will need to see Joey within 24 hours or not? And so in number one, Dr. Chad anticipates Joey's condition will resolve, okay, and that he won't need a follow-up within 24 hours. And the total time that he spent was 10 minutes. Now, there's two billable services there. If, in fact, that Joey is not going to come in within 24 hours of that call. The billable service is G2012, which is the brief communication with the clinician. And that's that communication, that talk back and forth that Dr. Chad had with Joey, with Sally. They were all present during that telehealth visit. And then another billable service, however, occurred, which is G2010. That billable service involved that picture, that image that Sally took of Joey's ankle and sent to Dr. Chad for review. Those two combined provide you with that virtual check-in. So now, that first scenario, Dr. Chad didn't think, Joey's condition was going to be a big deal and was going to resolve. All right. Well, let's look at what if it was going to be a big deal. Dr. Chad anticipates and recommends Joey be evaluated as soon as possible within the next 24 hours. So Sally brings Joey into Dr. Chad for an in-office visit. Is the virtual check-in service billable? No, it's not. Why? Because that either an E&M code or procedure code service was performed within 24 hours of the virtual check-in, that communication that they had. So that's a virtual check-in. Again, 5 to 10 minutes, brief communication with the clinician, captured video or images sent to clinician for review. And again, how many times has this occurred? It happens all the time, doesn't it? That's a virtual check-in. Those callbacks, that communication that you have with the patient, and that back and forth with the image and providing that clinical advice is a form of telehealth. Now, the rule is that there is what is called a 7-day, 24-hour rule in this particular telehealth procedure. And that means that a virtual check-in communication is not billable if there's an evaluation and management visit within the previous 7 days, or if it leads to, like we did in our example, if it leads to an evaluation management visit or procedure within the following 24 hours. And so if Joey would have had an exam 4 days before, on his ankle, let's say, 4 days before he went and played soccer and then, it hurt it again, that virtual check-in would not be billable. Or within 24 hours, if Dr. Chad saw Joey, this would not be billable. And so keep in mind that 7-day, 24-hour rule. And so the key question, as you think about it then, you have that call, you have that interaction, you've decided that, does that patient need to be seen or not? I mean, that ends up being the key question for the clinician on those virtual check-in communications, is that, does the patient need to be evaluated within the next 24 hours following that virtual check-in? That's a very key question, because if they do, then that virtual check-in is not billable, as we've mentioned. But if they don't, then that virtual check-in is billable, as we've talked about. And so that's the patient with a new concern. And so as you think about, how do patients, come to us? Well, they're going to call in. They're going to come through the portal. And the more that we have technology emerged into our communication with our patients, they will be using portals more. They will be wanting telehealth more. Well, they're going to call in. We can schedule that patient for an in-office visit. We can communicate with them through the portal if that's how they come to us through and or we can also move into that virtual check-in, which many doctors are currently providing today. So now let's take another look and let's look at that established patient under active treatment. And so the key question here we need to ask is that we have a patient under active treatment. Does the patient have a need for a telehealth visit? And so there could be a lot of different reasons for a telehealth visit. It could be transportation. It could be that the patient is just in a different state, or excuse me, within the state, but in a different location far enough away that they can't make it in. Or maybe there's other reasons why that patient can't leave their home. But again, very important to understand that we have to ask ourselves, what is the need for the telehealth visit? And of course, during this point in time, during the COVID-19 crisis, there's lots of reasons to be able to do telehealth. And so the very first step is obtaining informed consent, as we've mentioned before, and scheduling then that patient for a synchronous interactive audio and video telehealth visit. Now, what is that, Scott? Well, synchronous interactive audio video is that real-time audio video. You can see the patient, you can hear the patient, they can see you, they can hear you type of communication. That's a synchronous type of communication. Back to the example we gave where Sally sent Chad an image or a text message, that is asynchronous. All right, and so that's the difference. And so telehealth, as we're talking now, that synchronous audio and video telehealth communication. And so then you would proceed with the telehealth visit per your usual in-office procedures amenable to telehealth delivery. And then we have to keep in mind, into step 3, is that we document that telehealth visit per the usual guidelines and bill for services per our usual guidelines. We're utilizing the CPT codes that we typically do in office. We're doing it via telehealth if we are providing that telehealth service using a synchronous interactive audio and video communication. All right, it's just like you're in office. Basically, the procedures that you do in office, if they're amenable to telehealth delivery, they're treated exactly the same. They're documented exactly the same. They're looked at exactly the same. They're carried out exactly the same. Now, there's some differences, obviously, because we're not touching the patient, but we'll talk a bit about that. And so what are some of the services? Evaluation management services. We can take a history. We can do a visual observation of range of motion, active range of motion. We can do a visual observation of some orthopedic signs, some motor tests. We can visually observe that, how the patient is functioning. In addition, we can provide and supervise therapeutic activities, procedures, patient education, and there may be other counseling type services amenable to telehealth delivery that can be included as well. And the key thing here, though, is that we understand that that is just like you are treating the patient and providing clinical advice to the patient in office. All right, when you have that synchronous audio and video communication. And so as you provide that level of service via that type of communication, keep in mind all current CPT coding rules apply. So let's look at a scenario. We're going to pick on Sally again. Sally decided to request a telehealth visit with Dr. Chad for her son Joey, who's an established patient, for his ankle injury. She had previously contacted Dr. Chad. He recommended Joey be seen for evaluation, but due to circumstances, her car broke down. Okay, she was not able to get Joey to Dr. Chad's office in a timely manner. So then, following obtaining an informed consent, Dr. Chad, Sally, and Joey join in interactive audio and visual communication. And so then Dr. Chad performs a history of present illness. He reviews Joey's chief complaint. He asks Joey to stand and walk, observes his weight-bearing capabilities. He observes any noticeable swelling or bruising. Then Dr. Chad asks Joey to move his ankle through ranges of motion, actively and passively, and if there's any pain and where is that located, restriction of joint motion, so on and so forth. So then Dr. Chad's assessment when he's done is that this is a mild strain to the talofibular ligament. He recommends wrapping the ankle, and he provides Sally with instructions for that. Icing the ankle for 20 to 30 minutes, 3 to 4 times each day. And he does recommend a follow-up in-office visit within the next 2 days. Total time of the visit was 15 minutes. He billed a 99213 and used the -95 modifier. Of course, place of service 02. It was a place other than practice location. Inbox 24B of the HCFA claim form. And so where did he get the billable service of 99213? Well, we do know that there are time elements for evaluation and management codes. And under the current evaluation and management code guidelines, if you spend greater than 50% of your time providing counseling or care coordination, then you use time as an element. Now, keep in mind that in 2021, evaluation and management codes will move to a stronger time-based element with medical decision making. And that's another conversation for another day. But that is coming up. And so this is where you go, though, to be able to determine, okay, what did we do here with Joey? How long did it take? That type of thing. And then we're able to code appropriately. So let's look at another telehealth scenario. This one's a little bit different. This is Joe. And so Joe was in the office following a motor vehicle accident about 6 weeks ago. He was progressing really well in office care, and then COVID-19 hit. He's not comfortable with going outside of his home for fear of this contagious disease. And Dr. Chad recommended then that he continue with his rehab care at home via telehealth. And so following obtaining informed consent, Dr. Chad and Joe schedule a telehealth visit for therapeutic exercise for Joe's shoulder condition so that he can continue therapy at home. Now, you can see a list of exercises performed, total session time, one-on-one time. Exercises were performed by Raylan May and supervised by Dr. Chad. And of course, billable service 97110-95, 95 being the telehealth modifier, and 2 units met the coding requirements for 2 units. And of course, place of service, as we've talked about before. And so you can see that this can be carried out via telehealth. Again, that audio and video synchronous telehealth. And so when you have audio and video synchronous communication, then you are set, you are ready, and you know that what you provide that patient is just like you are providing it in office. Those services that are amenable to that type of a care delivery. And so again, follow your state law and payer guidelines for billing services. Your health plan benefit, or the patient's health plan benefit, will determine coverage, reimbursement, and then of course therapeutic activities, patient education. There are other services that are amenable. And keep in mind, under the audio and video synchronous communication, that CPT coding rules do apply. So now let's have an example here, and our friends at eChiroEHR have been kind enough to record a very, very short video, a telehealth demo right out of eChiroEHR. And so give me just a moment to bring that up.
Welcome to eChiroEHR. Today we'll be discussing telehealth capabilities within the eChiro system. So we have our test patient, Test Randy, who Ron is standing in for today, and they've connected through our online patient portal. That patient has arrived, so we're going to go ahead and start today's visit. We'll click Start Visit, and this will take us to that patient's chart. We actually have a note that is ready to go and completed for a full telehealth note. We'll open this up so you can see what a telehealth note would look like. We'll open this up with the Update Plus, so it is popped out as a secondary window. We can go ahead and minimize our eChiro system, and we'll be just operating with our chiropractic note here and then our telehealth module. We'll connect our webcam, make sure we connect with the right microphone, and click Join. It's going to connect us to our patient here. We have Ron here. Ron, can you see and hear me?
Hi, Zach. I can see you and hear you just fine.
Fantastic. So we can go ahead and modify our note. We can choose what note type it is. Today it's a telehealth visit. We can also go to our visit and change number of visit number. So say what previous visit was visit 8. This is now 9 out of 20 visits. We can go into our history of present illness and modify everything here as well. We're going to go ahead and keep this saved because this is what it would look like as a completed telehealth note. Ron, thank you for helping out today. We're going to go ahead and end this call. This has been eChiro Business Systems. Thank you.
Yeah, and again, thanks for our friends at eChiro. That gives you a very short live demo or understanding of telehealth and how easily it can be performed. And so as you think about the audio visual communication, if it's not available, what if you don't have that system that we just saw, or maybe you don't, maybe the patient isn't able to have that on their end. So then what do you do? Well, you can do a telephone consult. Now this is a different code though, so this is not like in office like we just talked about, but rather that telephone consult or telephone telehealth, you would be utilizing the 9944 codes, and of course again time-based with the discussion that you provide with the patient, 5 to 10 minutes, 11 to 20, 21 to 30. Now keep in mind that, remember when we talked about the virtual check-in, that there was that 7-day 24-hour rule? Well, the same 7-day 24-hour rule applies to this telephone consult. And so keep that in mind, that if you are doing telehealth just strictly through the telephone, that it is a different set of codes, okay, and you have that 7-day 24-hour rule. Again, it is not billable if you had performed an exam within 7 days prior to the call, or if you have performed an exam or procedure within 24 hours after your call. So that's just something to keep in mind as we talk about that. So to kind of sum it up here, we talked about that patient with a new concern. And again, whether the patient called in or came in through the portal, back and forth through the portal, e-visit, right? Or the patient could be scheduled in office, or maybe the doctor is going to call the patient back, virtual visit. That patient with that new concern, that's what you have available to you in terms of being able to deliver care to the patient. You can deliver it in office, hands-on, just like we're doing today. Or you can do it through the portal, providing the clinical advice, or again, that call back and that back and forth and arriving at some recommendations or clinical advice on the virtual check-in. So that new concern patient, it can be taken care of in that manner. And then we talked about the patient under active care. And we talked about the audio visual, that synchronous audio visual communication that was just demonstrated, that interaction. And it is just like we are performing our services in office. We use those same procedure codes. And now we've talked about the telephone consult. And so as you break it down, as you begin to think about it, hopefully that'll be helpful. Now, as I mentioned, and I told you I was a broken record, and now the record's going to be done, is in the area of informed consent, that telehealth services need to be initiated by the patient. Okay, this isn't something that you call up your patients and say, I'm going to give you a telehealth service. No, it needs to be initiated by the patient. Okay, and as we talked about this already within the context of a new concern, that patient's calling in, right? And then we're saying, okay, we get consent before we schedule that virtual check-in. We get consent, before we go back and forth on the portal with the patient. We get consent by that patient that's in active treatment and say, okay, I need your consent to do this. And it's important that it's initiated by the patient. However, we can educate patients about the availability of the service prior to that patient initiation. And so we can inform them. We can let them know that, hey, this service is available. And if you need it, here's the process that we need to go through. Now, also what's important is to make sure you check with your state law. And one of the links I provided earlier to you, and I think I may have brought it up, and you probably saw it on the screen, it said consent. And so it's important to double check your state law to see if they have any additional requirements for informed consent in regards to telehealth. And the key part here, you may say, well, Scott, how do you get them to sign an informed consent when they're on the phone or that audio visual communication? Well, everything that we've found, it states that we need verbal consent and then have a follow-up written policy or written informed consent. And so what's important to understand is that as telehealth continues to gain a lot of traction, some of these technology firms will have that informed consent available to the patient right there before you connect with them. So for instance, we just the eChiro folks showed us just very briefly that telehealth visit. Well, prior to that visit, that patient had to click on and accept consent before that patient came into the picture, and that patient was Ron. Zach connected with Ron, but before Ron could come in, he had to sign in on that informed consent. And so keep in mind that that's important, that we get that verbal consent, that we do follow up, and patients need to be aware of the cost sharing or the expense that they may have or that they may incur with a telehealth visit. They need to understand that that is a billable service. Now, the informed consent today should be done prior to each and every telehealth visit that you do. However, CMS, Medicare, which sets a lot of policy on how to use telehealth, and then of course, you may ask, well, Scott, why do we care what Medicare thinks about that? Well, the fact of the matter is that they are setting policy in telehealth, how they utilize it. Guess who follows Medicare? Commercial payers follow Medicare as well as everybody else. And so that's why it's so important for us to have our ears to the ground when Medicare coughs or sneezes. No pun intended on that. And so as we look at this, they are currently finalizing a policy to permit a single consent to be obtained for multiple telehealth communications. And so more on that later. But for now, let's make sure that you obtain verbal consent, informed consent, follow up with signed written consent at a later date, or if the technology that you use for the audio-visual communication, if it has capability for an e-signature that is a part of that service, then go for it. Make sure that you build that in. And of course, we'll have this for a download for you. Many thanks to Dr. Steve Conway for the work that he's done for the profession, and in particular helping draft this informed consent for a telehealth visit. We feel that this is a great start. And as you think about what's different on an informed consent for a telehealth visit, well, there's some different risk factors. We have privacy and security risk factors. Just because of that technology communication, we know that we need to talk to the patient about financial responsibility because this is new for them. We know that there could be some other risk factors because we could have connectivity issues. We could have maybe, where we're not able to communicate completely with the patient. So there may be something lost in that transition, right? As we think about that. Then we have the normal potential risks because they would be involved in possibly functional therapy procedures that we're having them do. And so there are some potential risks. And then we need to talk about what are the alternatives to telehealth services, chiropractic healthcare services, and what is their risk of refusing telehealth services and being seen. And so if you look in the upper left hand column, and I know this looks like a mess of words, again, you'll get the download and we'll show you where to go for that. It's important to denote the location of the patient. And so we have the patient name, we have the date of the visit, and then we have the location of the patient. Very important that that patient is located in the same state of licensure as the clinician. Okay, you cannot do this across state lines unless you have a license in that state. And so keep that in mind. We don't have a compact. There are medical doctors, or the MDs do, the nurses do, the PTs do, and this is an area where maybe our board of examiners, our national board of chiropractic examiners, need to take a hard look at bringing together some of our states around this telehealth service and developing a compact that would need to be approved in each state to say that we could go across state lines. And so just food for thought. But for now, keep that in mind. That patient needs to be located in the same state that you have licensure, and you're operating within your current scope of practice. And then you're also identifying what technology platform you're utilizing. and then what the purpose of the telehealth visit is all about. And just a word of caution: do not let the desire to bill for a telehealth visit turn into a board complaint or a malpractice claim. And so this is why it's so important that you talk to the patient about the cost of it, that it is a billable service. Make sure that you document that you receive that consent. And so, use your sense when it comes down to that. And so here's just some other tips before we close here. Be clear on what type of telehealth you're providing. We talked about that new patient concern. We talked about the active patient under active treatment. Under the new concern, we've got the communication going back and forth and clinical advice, whether it's the virtual check-in or the portal. Under the active treatment, we may have evaluation management that we're providing during that audio-visual communication, and or even some therapeutic procedures or activities or education. Make sure that you talk to payers, just like we talked about earlier. Find out what their coverage entails, what's their preference for coding and modifiers and documentation requirements. And keep in mind that evaluation and management services, like what we perform in office, as well as virtual check-in that we talked about, and e-visits, they are commonly covered by commercial payers. And so be looking for those codes. Ask the payers about those codes. Get a rundown from the payer what codes they cover and is included in the patient's benefit plan for telehealth. But become very familiar with your state law. And again, I can't emphasize this enough. There are going to be some continued rapid changes in this area. And so make sure that you're on the ball and that you're watching this very closely. Know your codes. That's one of the very first things we talked about. Understanding codes and then building your services out of that understanding is absolutely key. And that's why we broke it up the way that we did, that patient with a new concern and that patient that's under active treatment. And hopefully that will give you some good footage moving forward to understanding the coding process and the scenarios that they apply within practice. And as I mentioned, telehealth is expanding. Regulations are going to change. We're going to be finding insurance companies, maybe in some states, that are going to say, I'm not paying for chiropractic to do that, when in fact maybe their state law says that they have to. And so don't be shy about understanding the law in its full detail and making sure that you fight the good fight when it comes right down to it. And so keep your eyes peeled for payer messages, legislation, and all of that. Very important. And then these are some of my favorite resources when it comes to telehealth, and I just wanted to share them with you. I actually did more research than this, but it's important. These are the best ones, I guess I felt were the most important, that I got the biggest bang for my reading. And so feel free to take advantage of that. And then the last thing we want to leave with you are a couple of different items that hopefully they'll be helpful. At ChiroArmor, thanks to them, they have put together a white paper. And that white paper is about deploying chiropractic care and telehealth to patients during the COVID-19 public health crisis. And so it gets into what types of care should we be providing right now during the crisis, and then how do we leverage telehealth in order to carry forward care within this environment and beyond. We truly do believe that this might be a silver lining in this whole crisis, is that we will be adding another level of service and care delivery for our patients. And then also we have, thanks to eChiro, we have two notes, telehealth notes, that you can download and get a good look at. One is strictly an evaluation and management note example, and then of course the other one is a therapeutic procedure note example. And so thanks to eChiro EHR, and of course you can utilize this link right here to download it at eChiro EHR, their telehealth section. And so there you go, telehealth 201. Will there be a telehealth 301? There very well could be, so stay tuned. Really appreciate you. We're in exciting times, we're in challenging times, but our profession has endured a lot, and we will come out of this more valued than we were before. I can almost guarantee it. This has been Dr. Scott Munsterman. It's been great having you with me. Thank you for your time today, and looking forward to more conversations with you about care delivery. Take care.
Okay, we have a lot of questions. Yes, okay. Here we go. I will start with software to conduct telehealth. So we have a lot of questions as to whether or not it's okay to use FaceTime, Zoom, WhatsApp, or do they need special software?
Okay. So in the chat, I sent the link. It's direct from the Office of Civil Rights, and it's the notification of enforcement discretion for telehealth. And what they've done during this point in time is that they are allowing certain forms of non-public facing telecommunications. And so FaceTime works for now. Okay. Let's make sure we understand that this is a very temporary thing. And the OCR has in that web link that we sent you already, go to it and read it, please, because it's very detailed as to what they see as being HIPAA compliant. Again, they are making some exceptions only temporarily. And so don't be lulled into, well, I can just use FaceTime. Been doing it now for a month or two, and all of a sudden the guidance goes away and you're non-compliant. Don't let that happen. All right. So go to the link and you'll see exactly all the different opportunities or options, if you will, technology options that you have available for you. And I think that'll answer all those questions, Christy.
Awesome. Okay. And so that is, if you'll scroll through the handout or through the comments in the chat box, you'll see that link that Dr. Munsterman shared. Okay. So I was on a call yesterday and told informed consent had been waived due to circumstances and a patient's inability to come in office to sign or print and email back. Is this true or not?
No. And no. As we mentioned in the presentation, everything that we have come across, that we have read, you have to get, number one, verbal consent, all right, and that there should be a follow-up of written consent. And so what I'd recommend you do would be that when you have your informed consent form, and we're providing you one for a download, all right, that when you get that verbal consent, that you document it in your patient record, number one, that you obtain verbal consent, and also go ahead and witness on that form, if you will, that when the verbal consent was provided, and then the next time the patient comes in to see you, I'd recommend that you get that signed by the patient. Now, again, this is an area that needs to be shored up, frankly, in telehealth, and we're going to see a lot of developments in telehealth come in days and weeks to come, in months to come. And so, as I mentioned in the presentation, some of these technology companies already have this figured out with the e-signature, like what we talked about with eChiro and some other technologies. So when you're looking for a technology platform, if you can't do it through your current EHR system, then I would recommend that is one of the questions that you ask them, is that can you have an e-signature option for telehealth? All right. But for now, make sure that you get verbal consent and that the patient understands it's a billable service, and all the different categories or thoughts that we talked about regarding informed consent in the presentation.
All right. So the next question is, how do you collect a copay? Is the copay the same as a normal office visit?
So again, this is something that you need to visit with your health plan about. And so if there's state law that has coverage parity or reimbursement parity, that's going to answer your question. So again, go to your state law, review exactly what your state has for requirements, then go to your commercial payers and then ask them their questions. All right, the same questions as to what's covered, all of that. That's where you have to do your homework on this whole thing to understand your state your health plans that are in your area, and that'll answer that question for you. All right.
Okay. And how would this work for cash patients?
It's just like any other service that you provide in office. If it's covered, it's covered. If it's not covered, it's not covered. And again, once you've understood the state law parameters as well as the health plan, what's covered, then it's like anything else. Make sure you let that patient understand what their cost share is or what the expense is to them. Again, verbal consent comes into play once again, because this is a new service for patients. And I can't overemphasize that. I can't. That you need to make sure that you have that verbal consent, and then again, follow up and document that as much as you can.
Okay. What insurance companies cover this service, and what are the customary fees?
Yeah, and see, and again, that's goes back to what we mentioned earlier. Any questions, Christy, actually on health plans and what they cover and all that? Again, go back, do your homework on your state law, talk to your health plans. It's going to be different for each state.
Okay. I thought Medicare changed what to put in Field 24B to be where services would have been provided if in person with 95 modifier.
Okay. First of all, with Medicare and with what they approve for us to do, obviously we can't adjust people over the phone, no matter what Dr. Myers thinks. He was kidding, and I know Dr. Bruce quite well. And so in regards to chiropractic, there aren't any billable services that we are going to be billing Medicare for, from that on a covered service perspective. But place of service is O2 when you're doing telehealth. It's not your office location.
Okay. Let's see. When done by telehealth, which therapy code should we choose if a chiropractor is giving advice on stretches and exercises for the patient to perform?
Yeah, and I would recommend that depending on what you're doing with the patient, just follow your normal CPT guidelines with what you're doing and make sure you document it appropriately. And if you're doing telehealth, as in the audio visual communication that's synchronous, like we talked about, it's just like you would do in your office.
Okay. The 7-day previous E&M service has to do with the new concern of the patient.
I'm sorry, say that again, Christy.
The question says the 7-day previous E&M service has to do with the new concern of the patient.
So the 7-day, 24-hour rule applies in 2 instances. All right. It applies to the virtual check-in, and that was that new concern, how we kind of talked about patients coming to you, initiating, and engaging you. They may call in with a new concern. They could do that through the portal. They could do that where you're calling them back. Well, the callback or the virtual check-in, after you have that conversation with the patient, if you had an evaluation or exam performed 7 days prior to that call, or if you're seeing the patient within 24 hours after the call for a procedure or an exam, then you can't bill for the virtual visit. And the same applies to just strictly telephone consults that are telehealth, telephone only. And we covered that last in the presentation.
Do you have a sample of a verbal consent form?
The informed consent form is the informed consent form, and we recommend that you go through that informed consent form with the patient that we're providing for you. You can do your research and use whatever form you want, but consent is consent, and we recommend that the patient is fully informed, just like on a normal informed consent process.
Okay. I have both a Connecticut and New York state license. I'm thinking she's just asking, like, which rules should she follow? And I'm assuming that it depends on if her patients are in Connecticut or New York.
That's exactly right. It's patient location. And so in that case, make sure you're familiar with both state laws and obviously the commercial payers and what they will allow. And again, I also recommend that you connect with your board of examiners in your state association. And everybody should be working on this together as we continue to work towards providing better care delivery to patients, especially during this time.
Let's see. When do we use G codes versus CPT codes again?
Okay, if you go back in the presentation, and I just would recommend probably watching this video again, because it's a lot of information and we try to put it in a manner that might make more sense. How the patient initiates or during active treatment. But keep in mind, what we're talking about there is the virtual check-in, is what we're talking about. I believe that was the question, right, Christy?
Mm-hmm.
Or why don't you tell me the question again? I want to make sure I answered it correctly.
I may have lost it. I may have to go back and find it again. Hold on one second.
I apologize.
That's okay. I'm trying to flip through them as quickly as they're popping up. Here, I'll go back and find it, and then we'll come back to it.
Okay.
Since you are not billing Medicare, should we have an emailed ABN since it's not covered ENM-wise?
You would treat it the same as what you would do in office. Again, this audiovisual telehealth visit that's synchronous, that's just like what we're doing right here, Christy and I, telehealth, right, Christy? You're going back and forth here a little bit. Audio, video, synchronous communication. That's what this is. It's not any different than you being in your office. So your normal procedures, again, they apply, whether it's CPT coding or how you handle patients, your ABN form. I mean, all of those things apply. They're exactly the same in this type of a synchronous setting.
Okay, this one says, so the 99441 through 99443 codes are only for telephone consultations.
That's
no
correct.
Visual contact. So this code, these codes should not be billed with 97110, correct?
So exactly. Because you're not seeing the patient, you can't supervise the patient, correct? Mm-hmm. And so this would be a case where, let's say that the patient is unable to connect, for that synchronous audiovisual communication, or maybe doesn't have the capabilities, and yet they need some counseling, clinical advice. When I say counseling in our framework as clinicians, it'd be that clinical advice or that discussion, taking history and coming to a conclusion, and then making through our clinical decision making a recommendation for them. And so that's the type of conversation you would be doing just strictly by telephone.
Did you say to use 02 for location when doing a telephone consult?
Yes, that would be the place of service would be 02.
Yep. Okay. Y'all forgive me because I know I said 02 earlier. Let's see. What code if AV, FaceTime, non-EHR visit? I don't know.
Yeah, so I think I know what they're asking. I think. So if you're using FaceTime, which currently is allowed for telehealth, audio visual communication, okay, mm-hmm. Then it's just like, we've said, it's just like you being in your office. In what you do in your office for a patient, evaluation management, whatever's amenable to telehealth, right? Then that's how you would be billing it. The difference would be you would have a place of service on the HCMA form as 02, and you would be using the -95 modifier after your procedure or E&M code to signify that was a telehealth visit.
Okay. Can you bill a telehealth visit if a 98941 was billed within the last 7 days?
My best answer to that would be yes, because the coding rules strictly say evaluation and management 7 days prior to the virtual check-in, but then it says if within 24 hours they have an evaluation management or procedure, then it's not billable. So you're okay the 7 days prior, unless it's an exam, evaluation management code, right, or service, I should say. But if it's 24 hours after the virtual check-in, that callback, it could be any procedure or exam that you would do during that time, and then that would constitute it not being billed. So the answer to that question would be yeah.
Awesome. Joseph, you are too sweet. So for all the people, I've been deleting your comments that say, when will I get this recording? The recording is sent out 1 hour after the webinar wraps up, and everybody who registered gets it. So you don't have to send me your email address because I have it already. But it automatically sends it out to you as soon as it's done processing. How do you bill for sending a patient in-house made exercise videos?
I don't think you do. That would not be considered telehealth. Not from what I understand today. Okay. That's my answer. Sorry. And do some homework on that. And if you have any other questions, make sure you let me know.
So I just want to remind y'all that tomorrow we had over 100 questions that were not able to answer from the Families First Coronavirus Response Act webinar from 2 weeks ago. So they are going to give you some updates on that act tomorrow at noon Central, 1 Eastern, and then answer all of those questions that we did not get to. So if you have not registered, make sure that you do that. Next week, Dr. Munsterman is going to be here, same time, same place. And do you want to tell them what you're talking about next week? Because I haven't posted it yet.
Yeah, well, we're going to talk about OSHA. And we found ourselves in the crosshairs of needing to understand very quickly exposure control and infection control and some of those types of things. And so we're going to be talking about what are other OSHA requirements that we need to have in place within our practice, because it's all about protecting our staff, ourselves, and our patients. And so we thought that this would be a good time to kind of do a review of all of that. And so that's what our discussion is going to be about next week, and how you can get those policies in place in your practice as well.
Awesome. So also, every one of these webinars for COVID-19 that we have done, all the recordings are here on this COVID page as well. So make sure you go and check those out. If you earmarked, again, if you downloaded the handouts, all of those links work, because obviously I am technically challenged from time to time. So they will, if you click the links, they will work, but make sure you check back, because we finished that white paper that is awesome, but we finished it like 30 minutes before we went live. And so IT probably hasn't uploaded it yet, obviously, because a lot of y'all were like, when will it be available? So just check back in an hour. I emailed them and was like, guys, we need this up like right now. But if there were other webinars that we found that we thought that you would benefit from NCMIC and some other resources, we've added them here because we want to be your one-stop location for all things COVID-19. Here's updated news, downloads, and again, check out all of those links that Dr. Munsterman he's the rock star, guys. Y'all are so sweet. I love y'all. But he's the one who's doing all this research 24/7. Like, I don't think he sleeps sometimes, because he is constantly working on this, and y'all just wouldn't believe how updates come up. Like, we will finish something and then it updates, and then we have to go in there and we have to fix it and change it up.
Sorry.
So he and Dr. Conway are like constantly doing that. And so, or like, ferreting out more information, because it'll be a little vague and it doesn't tell us what we really need to know or what you really need to know. So again, make sure you're checking back, register for all these webinars. I know that we're trying to be a little more consistent with times, but it's kind of hard. But if you register for it, you are guaranteed to get a link to the recording. Hey, yay, it's up. The white paper is up. Thank you, Ashley. And so this week was her birthday too. I'm just going to throw that out there because we're all homebound at the moment. So happy birthday, Ashley. But so download the white paper. Y'all can click the link in the chat box. Make sure you get the handouts. If you have questions afterward, just let me know. Or if you're watching the recording right now because you missed the live one, you have a question, type it in. It sends it directly to info@ChiroArmor.com, and it comes to Ashley and I. We will make sure that Dr. Munsterman gets an answer for you, or Dr. Conway. So thanks, guys. Y'all have an awesome day.
Thanks, everybody.
Bye. Oh, I might help if I was on the right screen.